Let me begin with congratulating the Ministry of Health for the release of the Diabetes Registry Report 2013-2019. This report provides very valuable information on disease outcomes and also informs how to improve service delivery and management for patients living with non-communicable diseases, NCDs, like diabetes and also hypertension. So data are for action, the interpretation and analysis of the data and can inform our response. So that's a big achievement and very important to the work. So just to emphasize that for WHO, the prevention of risk factors and the management of disease, of non-communicable diseases, is at the heart of the work of WHO. And in particular, diabetes and hypertension are modifiable risk factors for reducing death to cardiovascular diseases. So let me give you some examples of WHO's work. We have the WHO HEARTS technical package, the HEART, which explains or makes the linkage, or which shows the interrelationship between risk factors like diabetes and hypertension with cardiovascular disease deaths. It focuses on the primary healthcare level and provides operational guidance how to screen and manage patients with diabetes, hypertension, and other disease risk factors. Second example is the insulin pre-qualification program at WHO, which was launched in 2019, last year, which aims at improving access to these life-saving drugs for people living with diabetes. But let's come to the nurses. The nurses are the most critical, most important component of the response to diabetes, for the management, for the screening, for the health education. 60% of the health workforce are in fact nurses, and we should be cherishing, celebrating them every day. But today, on World Diabetes Day, is a good opportunity to pay particular attention to the achievement in nurses and to applaud them. So with this, I would like to applaud the nurses, the many healthcare workers around the world who are continuing their services amidst the COVID-19 pandemic. NCDs are particularly important because they are a risk factor for COVID-19 disease outcomes and deaths, so their service and continuing services for screening, management of diabetes, hypertension, other NCDs is absolutely critical in the context of this epidemic. They work very, very hard. So let us congratulate the nurses, and let us also applaud the Ministry of Health for its commitment to improve patient outcomes and share data on non-communicable diseases like the Diabetes Registry Report.